Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
All right, Linda. So this is your second visit. So can you give me a little bit update about how did you feel after the first visit, and are you still maintaining the range of motion?
Yes. So, my hand could do all kinds of things. I can use the steering wheel on the car.
Oh, wow.
I could turn the knob, the doorknob. I could wash my hair. I could do some dishes.
You could not do that before the first treatment.
Not with my right hand.
Not with your
my
right
left hand. That's why I came in. My left hand was starting to get so much overuse that it was like starting to act up. I went like, I can't lose both thumbs.
Oh, wow.
So I haven't been doing anything with this right hand. And so like I could do all of this now, which I would never dare to have done that before. I could still look at that. Touch.
Yeah, that's from the first treatment. Yeah.
And that deep aching pain that I've had for like 2 years. I don't have a deep aching pain.
Yeah.
I mean, I could still feel a little bit of residual of something, but that deep aching pain, I don't have any deep aching pain.
That's beautiful.
Yeah, and look at this.
Yeah. Time to show off.
I know. After 2
That's
years,
beautiful.
amazing.
That's amazing.
Yeah.
So okay, today the second treatment. So tell me what do you want me to work on today?
Okay, so what I did notice is as I was kind of doing all this kind of stuff, I realized that I had not known before, I could touch the bottom of my fingers with my left hand, and I could bend this first crease.
The first joint there,
yeah,
and your thumb like this.
Right, so that guy could do that.
That's
this
the
guy,
left hand.
Yeah, that's my cute little left hand.
Okay.
And then this guy, he could touch here and he could touch here.
Okay.
He cannot go any further than this. I have tried and tried.
Okay.
And when I try to do this,
okay,
he will not do it, or she will not do it.
All right. So we need to work on this range of motion.
Yeah.
All right. Awesome. Okay. So we'll start working on it. So you feel the tightness right in here, yeah?
I don't.
On the back or the front? Or
the sensations I feel are down here. I don't feel anything there. It's I don't feel anything there.
Yeah.
It
so
just
the
won't.
pain is not.
It is now that you're
touching it. So it's sensitive to touch it.
A little sensitive, but I didn't know that.
But the problem is making that motion.
Yeah.
Doing that motion.
Yeah.
Okay. So let's show it again. Try to. Can you isolate the joint? She's not able. Yeah. She's not. She's just moving this, but not moving this joint. Okay. And that's for 2 years you have not been able to move.
I didn't know it.
Yeah,
because
well, the first treatment.
Because there was so much pain going on down here.
This was actually like hard for you to even do this motion.
Yeah.
So this is the joint. But is it tender to touch or?
No, now it's not so bad. It was more tougher when we had the.
That's the instrument. What about now?
Not now.
That's good. You're still maintaining the range of motion again from the first treatment.
I know. It's exciting.
Yeah, awesome. Yeah.
And yesterday I just kept doing everything. I thought, let's just test her out.
Yeah.
And she just kept saying, okay. Yeah, she was real cooperative.
Yeah, that's good.
Yep.
That's our goal, to help you to get to your normal function. And you are right-handed.
Yeah.
Yeah, that's tough with the right-handed,
It's been
Yeah.
crazy. Because, you keep thinking, oh, it's going to heal, it's going to heal.
2 years? Wow. Yeah, usually if it takes like few weeks and if things is not improving, it's better to get medical attention. Is that too much what I'm doing? It's okay.
Nope, it's fine.
What about when I do this?
Fine. Yeah, it's fine. Yeah, this is great. Believe me, in the past you could not have done all this.
No, even yesterday, like the other day when I was working with you, you were very like tender to touch.
Yeah.
Is that too much? Or
No, it's not.
I'm not giving her injection, okay?
Little
Too
bit,
much?
not too much, but definitely more tender on that side.
Mm-hmm. The sides are okay?
Seems to be doing okay
So the tenderness more on the top.
so far.
Okay. So it's right in here. Is a tender one I'm doing this one?
Teeny bit.
Okay. What about the tenderness here? Because the other day that was tender.
Well, it was interesting because I was really trying to observe last night,
Sorry. Wow.
and there was all kinds of weird stuff going on, and I had like a lot of stuff on the outside of this going
What
up.
do you mean? Sensation, you mean?
Like numbness, tingling.
Mhm.
I don't know what it was, and I had like a lot of tenderness here, and I had like up in my
Make
whole
sure you
arm
drink enough water.
was just.
Okay. Mm-hmm.
But then as time went on, a lot of it lessened,
Okay.
got less.
Just remember, for 2 years you have not do a lot of this motion.
That's what I
So
figured.
when you start moving it after 2 years,
All these
you
muscles.
start to have like some sensation. You will feel soreness because your muscles are very weak. You have not used before. It's like you have not been working out for years, and you decided to
That's
work
what I
out.
figured.
So
That's what
it's
I
normal
figured.
to feel like you work in your muscles. Things that start to wake up. But as long as you don't feel pain, that's fine.
Yeah,
But when you have soreness like that, make sure you drink enough water, because when I do release, it releases a lot of toxins in this product. Make sure you flush it out so you don't feel soreness after the treatment.
okay. Yeah, and even by this morning, a lot of it was already lessening, and you could
That's
really, you could
beautiful.
just feel the progress so quickly.
That's good. So, and before you had acupuncture, yeah.
I've been doing acupuncture. Originally when this first happened 2 years ago, I went to my chiropractor.
Oh,
But
so you had chiropractor? Okay.
yeah, a couple years ago when I first had the injured finger,
Mm-hmm.
and chiropractic is usually really good for me. I have a lot of success with it, but it wasn't working for this thumb, and so then I just kind of like did nothing for a couple of years,
Mm-hmm.
and then like I say, about 2 months ago, all of a sudden.
Mm-hmm.
I don't know what changed, but she got really unhappy, and she started triggering, which also at the same time.
Yeah.
So I knew I had to do something, and that's when I went to the acupuncturist, and
Mhm.
she did help get a huge amount of inflammation down, because it was like really severely inflamed.
Mm-hmm.
But
the range of motion you have not gained.
nope, and I could just tell that
And that's what's
it
more
wasn't good.
important.
And the
It's
triggering
function.
didn't stop. The
It does
triggering
stop.
stayed.
Well, the more important is to get to normal function.
Yeah.
If you cannot get to normal function, I think the treatment failed.
Right.
You know.
Exactly.
Yeah. Mm-hmm. It's like you can do a lot of stuff for temporary pain relief, but the point is to get a long-term result, and that shows the success of the treatment. Okay, let's move it. Try to wiggle this. Yeah,
I'm trying.
this one, like this.
She does good when you do it. Let me try it now.
Try it now.
Ah.
Can you touch this area?
Well, look, I'm to my third finger. Let me try
Okay.
the fourth. And look, well, ow!
Okay, what happened here? Muscle spasm?
Something happened.
Okay.
But, so, I could go to the third, but I can't go to the fourth yet.
Mm-hmm. Where did you feel it?
I felt like in the trigger spot.
In here, right?
Yeah.
In here. Okay. Is that painful? It's okay.
It's okay.
Well, we start doing motion that you have not done it for a couple of years, so
Yeah.
I sometimes you will get some like random muscle spasm because your muscle does not know how much force you need to exert to do the motion, so it's overreacting. So that sometimes causes a muscle spasm. Let me know if it's too much, okay?
Okay, that feels good there.
Mm-hmm. A little too much what I'm doing? It's
Nope,
okay.
feels good.
Mm-hmm. Okay, try it again. Closer.
Well, I could get to this first joint.
Mm-hmm.
I can't quite get to this joint or this joint.
Where do you feel the tightness?
I think I feel it in here.
In here? On the top or on the bottom? Here or here?
Kind of like both, like
Mm-hmm.
like.
The whole joint.
Uh-huh.
Okay. This is the joint. Is that too much what I'm doing here?
Nope.
Mm-hmm. Oh, sorry.
That's okay.
Sorry.
That's no problem.
Mm-hmm. That's painful?
That's always a painful spot. That's kind of like
You feel
a
that scar tissue, yeah? Mm-hmm.
yeah. That's every time anybody touches there, that's always tender.
Okay. More about that.
Yeah,
Make sure it's not tender, okay?
yeah. It's I have had carpal tunnel in both arms in the past, so it's probably like more of what I call residual from having that in the past.
Mm-hmm.
Because I always have trouble, like, what do I always say? Don't touch my
Let's try it
arms.
again. Turn it over and let's show us. Can you touch this?
Do that.
Okay.
I could do that.
Mm-hmm.
Oh, good. Look at that.
You get in
Couldn't,
here.
couldn't
okay.
do that.
Okay.
And
You
I'm
get in
down to
there.
the next. Okay, because
Okay.
remember I went to there just a minute ago, and now I'm there.
You're going down. So you're bending. You see that? You're bending here.
Good. Oh, look
Yeah.
at that.
Yeah, you're
Oh,
bending. Here
look
you
at
go.
that.
Let's lower this and bring this up. Here you go. Let's move. You see the movement now? Start to moving. Yeah.
That's
But-
definitely more than
but
she
we
was
need,
doing.
We need more movement. This is not enough. The goal is to be able to do this. Look here. That's our goal, to get it moving like this. That's mean function movement, not just temporary pain relief. Too much?
Nope.
Okay. Make sure you tell me again.
Yeah. The upper arm
Mhm.
is more tender than the hand. Isn't that funny?
Yeah, well, you have a lot of scar
Currently.
tissue there. Did you do a lot of repetitive motion? Oh,
Yeah,
the
what-
accident. The
Well,
accident you had, you jammed your
The reason I had
with
the
some-
carpal tunnel was I was going to court reporting school,
Oh, okay.
and that's really repetitive. And I was
so
doing that.
you
Like,
had to,
yeah,
Oh, man.
I blew
Okay.
out both arms.
Okay,
Like,
just get both of us. Yeah. Is it too much?
no.
You can do the close-up when we get to do the movement. Too much?
Mm.
Why you
It's
feel things
tender.
like-
It's very tender.
Make sure you tell me, okay?
Well, I don't know how much. It's like not like I can't stand it, kind of.
Mm-hmm.
I mean, my arms have.
Mm-hmm.
Now you're talking like 30, 40 years of
Mm-hmm.
old
A
stuff.
lot of repetitive motion.
Yeah. Okay.
Mm-hmm.
It gets more tender as you go up.
Mm-hmm. Too much?
Not too
So-
much though, but it's
Mhm.
pretty tender.
Mm-hmm. Sorry. Okay. Almost done.
It's okay. No, it's fine.
Couple of more hours of doing this. Not
Not at all.
Okay, let's get a close shot. Let's do it.
So I could do this,
Beautiful.
and I could do this, and I could do this, and I could do this, I could do this, I could do this.
Almost
Can't
there.
quite do that.
Where do you
Let's try
stop?
that then.
Where do you feel the tightness?
About,
No. Where is the tightness?
oh, here.
In the joint itself. Yes.
That's what it feels like.
Okay. Sorry.
That's okay. That's just a
Okay.
little tender spot.
Tender spot here. Okay. Is it too much?
That feels good in there.
Okay. I'm not trying to take her fingers apart, okay? Yeah, that's not good.
No, even when, like, I say like it's a little sore,
Uh-huh.
it's not like that terrible.
Oh, okay. We just work on 2 years no movement, a lot of restrictions.
I hear you.
Yeah, so that cause there's a lot of restriction in different areas. So
Yeah.
try to release 2 years of restrictions. Let's take a little bit.
I tell you, if I only had the improvement that I got in the last 24 hours,
Mm-hmm.
I'd be thrilled.
Yeah,
I mean, because even though my thumb may not be all that bendy,
hmm
it's so much more functional.
we'll see how far we can go. My goal is to get you back to 100%. So we'll see.
I'll
we can
I'll
do
hang
that.
ouch. I'll hang
Okay,
in there with
sorry.
you. That's okay.
Yeah.
That's a very tender spot.
Sorry.
I found the tender spot right
Yeah.
on the bottom,
Yeah.
inside the crease.
Mm-hmm. Okay. Try it again.
Okay, so here's this.
Mm-hmm.
Wait a second. Okay. I don't know. She's pretty sore right now. I gotta
Sure.
be honest with you.
Okay. Let's relax. Okay. Is that too much for you?
Not too much, but it's tender.
Okay. Mm-hmm. We need to get you some more, maybe.
That feels really good right there.
Here or here?
Both.
Both of them?
Yeah. Whatever you're doing right now,
Mm-hmm.
I'm loving it.
That's good. Okay, try it again.
I just can't get down to the bottom. But let's see if this guy's bendy.
We still have some more work to do.
A little bit, but she's trying.
Yeah. You start to have some movement.
Mhm.
Okay. Movement.
Yeah, I could
Start to
actually
have
see a little
movement.
bit of bendy back here.
Yeah. Can you do this?
I could definitely do this.
That's beautiful.
Yeah,
Mhm.
that I could definitely do.
Mhm.
And I could do first notch.
The first knot, we start to get
Here's
there.
the third notch.
Third knot. Okay.
Well, you know what? This probably the pinky's such a short little finger.
Mm-hmm.
But the thing is, see, I could do it with this guy. Look at that.
Yeah. Okay. Try it again. Almost there.
It's almost there.
Okay.
It's almost there.
Almost there. Okay. We're getting there. Mhm. Too much here?
Mm-mm.
Mm-hmm.
It doesn't. It feels good.
That's good. Okay. Oh, you're touching it a little bit. Oh, wow. Okay. You see that? Yep, you're getting there. Okay, let me actually do one more thing.
Yeah, look at that. If I pull back, look at that.
Yeah, we need to get it there. Just 1 second, okay?
Yep.
We get it, okay. Too much here?
It's a little tender.
Okay.
No, that feels fine.
Okay. So we want to touch. Too much?
Mm-mm.
Okay.
Feels good.
Try again. Yeah, you're getting there.
Look at that.
I want you to do my favor. Do 10 this way, and then we'll try it again. Just go back and forth. Good. Okay. And then after that, we'll go down. Keep going down gradually. Good. Keep going. Good. Okay. Keep going. Keep going. Let's do this.
Oh,
Just back
look
and
at
forth.
that. Look
Yeah.
at that. Look
Yeah,
at that.
let's do it 10 more. 10 more in front of the camera here. 10 more in the middle. The middle.
The first or the second one?
Just do this
the
one
top
and
one.
then do the second
Oh,
one.
okay.
Just then do 5
So
this way.
1, 2, 3, 4, 5.
Go down and do
1,
5. Just keep
2.
going back and forth. Don't think about it. Just don't think. Just do it. Do 10. And go a little bit lower and do 10. Fast. I fast. Don't think about it.
Well, you know why? It pulls on my thingy.
Okay. Okay. And relax. You get in there. Okay. And relax. Okay. Okay, one more time. Let's try to touch it now. Beautiful. Look at that. Now she can touch it. Awesome. Beautiful. Now we get it there.
That's so cool.
Yeah, yeah.
That's so cool.
You get it there. Can you see that? Can you see that? Beautiful. It's good. Just a few minutes. So what do you think?
It's like a miracle.
Yeah,
That's
awesome.
a miracle.
Yeah, yeah.
That is so cool.
Yeah,
Look at
yeah.
that.
You can touch that like the other one. Can you get both of them here?
So I can
Look like
touch them.
twins here.
Yeah.
Yeah, beautiful. Look at that. Before, and you know, if you can like go back to the video, she was having hard time even to get here, and today she was able to get here, but it's hard time to get here. Now she's able to get here.
Look at that, and
That's
she's
beautiful.
staying.
Yeah.
She's
yeah,
not.
Yeah.
Look at
Yeah,
that.
can you wiggle a little bit? Yeah, look at that, wiggling now. Yeah,
Yeah.
that's beautiful. Good. Second treatment. Awesome. Yeah,
Woohoo!
what do you think?
It's a miracle.
Yeah, awesome. I'm glad you're doing better. Yeah, awesome.
That's crazy.
Yeah, thank
Tastes
you.
Good.
Yeah,
Definitely.
yeah. Now you can.
Woo!
Yeah, thumb up. Awesome. Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.